Yeah, the next speaker is Dr. Sharad Bhomaj, who will speak to us on spectralis versus OPTOS imaging.
Good afternoon, everybody. I'll just share my thoughts on comparison of these two technologies. Start moving ahead. Yeah. So I'll come to first color photography, comparing spectralis versus OPTOS. Now, with color fundus photography, there is no competition here. Straight away, the OPTOS is the technology for capturing the fundus photographs, because it captures wonderful images right from the disk to the periphery. So the spectralis cannot do this kind of things. And but there are some caveats. No technology is perfect, like we humans are not perfect. We miss findings, our wide field fundus photographs pick them up. And some things are missed by the wide field photographs, but we can pick them up. So there is nothing which is absolute. So clinical examination remains the gold standard, and these are things to supplement our shortcomings where we don't have time to examine our patients nicely, or a patient who doesn't want to get dilated and you have a quick screening to examine the patient right from the disc to periphery. So this is the application for the ultra wide field fundus photography. Now, whenever the lesions are highly elevated, especially in the periphery, you cannot document this with any other technology other than ultra wide field imaging. So standard color fundus photography or whichever technology with the depth of resolution which you need will get only with the panoramic view. So with this technology only you will be able to so again, this is a peripheral choroidal detachment. You can see that this can be picked up only with the ultra wide field imaging. Excellent tool for documenting your pre and post interventions. So again, you can see excellent in the presence of a vitreous hemorrhage where a traditional fundus photography cannot do it. So it provides you a wonderful panoramic view. It is also good for disc cupping documentation. You know, with the standard fundus photography, you have bleaching of the disc, whereas in the OPTOS, you don't have any bleaching of the disc. You can have excellent cup to disc ratios and with the undilated, extremely good. Then elevated lesions in the periphery, as I said. And the most important thing is it is complementary to your clinical examination, and indirect ophthalmoscopy with scleral indentation remains the gold standard to pick up everything. And it can miss lesions in media haze, uncooperative patients and lash artifacts. So if you don't see anything on the ultra wide field fundus photograph, doesn't mean that the fundus is normal. You have to do your scleral indentation examination. Now we go to the next technology, which is the spectralis. It works on laser technology and it highlights whatever is there visible to that it captures. It highlights it very nicely. But the limitation is it will give you images only up to 55 degrees. It is very difficult to get a steered views with this multicolor technology. It is not very easy to do it. So for all practical purposes, you can say it gives you good images, but there are some shortcomings. You cannot image the periphery. But the true strength of this Heidelberg Spectralis lies in multicolor imaging of the posterior pole. So I'll show you an example. This is a patient with a 42 years old female with a disproportionate vision loss. And if you see it like this, you can say that the fundus is normal. You will send the patient for MRI imaging. That is what the patient was sent for, MRI imaging for some other. They didn't want to get MRI, so she came to us. On OPTOS, everything is normal. But on multicolor, you can straight away make a diagnosis of a parafoveal telangiectasia. So for small, minute pathologies, which are very subtle, still for the macular imaging, the Heidelberg Spectralis is a step ahead of the OPTOS. The true advantage of OPTOS is to get very panoramic views, but very, very small lesions on the macula can be missed by this technology, which can be picked up by the Spectralis. Again, this is a patient which has got a subtle disc edema, not very sure. If you look at the fundus photograph, you cannot be sure whether there is a disc edema. But when you compare on the multicolor imaging, you can see there is a stark difference between the other eye. And you can see that it is grossly abnormal, the disc. and you know that this is a true disc edema. Again, this macular pathologies, left eye looks normal and right eye has got a ERM, but it's not that prominent. So you can see on the multicolor posterior pole imaging, very nicely you can see the macular pathology, and you can see the pathology even in the left eye, which was not visible on the OPTOS fundus photograph. So very small pathologies are missed by the ultra-wide field imaging. The true advantage of ultra-wide field imaging is the periphery, but very small pathologies, minute pathologies of the macula can be missed sometimes. The media is not clear of the, or the fundus photograph is not clear, you can miss images. So that this is the difference. Other thing is that when you want to give printouts to the patient, this is the wonderful technology. You get very good macular images and very good macular OCTs, and you can give a nice printout to this patient, which is also important practically to during the practice. So for posterior pole pathologies, I feel that this is an excellent technology to. We want to suggest the OPTOS people to gear up to have better quality of fundus photography printouts. I'm not very happy with the quality of resolution of the printouts. The soft copies are excellent, but the printouts are not that good. Whereas the Heidelberg printouts are excellent. The patients are very happy with the printouts. So color fundus photography, Heidelberg Spectrali is good for especially the posterior pole imaging. OPTOS is excellent overall, but it can miss the minute pathologies. Infrared photography is not possible with the OPTOS, and why is it important? Because of the excellent red-free imaging, you can see that the infrared imaging, not the red-free, infrared imaging, you can see what, the black and white things on the fundus image, exactly where your scan is passing through, what area of the fundus is being imaged is seen excellently with this. So that is the true strength of the infrared imaging, which is very important. Now you can see a wide field fundus photograph. This is a patient of a retinoschisis, and this infrared technology can highlight this elevated lesion much better. So you can see the true extent of the bulla much better with the infrared technology, and it has been better than the autofluorescence. You can delineate this elevated lesion, and you can see that it has been one of the suggested modalities of documenting the progression of schisis, infrared images. It is more sensitive than the fundus photography. This is a patient, I could not get very clear images with the OPTOS, but with the infrared images, I could get this patient of PSCR, a peripheral hemorrhage, and the leaking lesion. So the next technology is the infrared technology. There is no comparison because it is available only with the Spectralis. Now autofluorescence, both are excellent, but extremely minute pathologies of the macula are seen in very good resolution with the Spectralis. So you want to follow up a patient of a geographic atrophy or for dry AMD clinical trials, this is a more standardized technology and more used for the dry AMD trials. But the advantage of the autofluorescence you have seen in the previous talk, panoramic view autofluorescence imaging is not possible with the Spectralis, and it holds its own against this, and it also provides excellent macular autofluorescence, the OPTOS. So more or less they are equal, but if you want to have a very minute follow up of the macular pathologies, I think it is slightly superior and it is more standardized. So for all clinical trials, dry AMD especially, for angiography now the true advantage of the OPTOS angiography is the true ultra wide field, which you cannot get with the Spectralis in one go. So you can see these are the wide field images of the ultra wide field images of the Spectralis OPTOS, also applicable for these posterior uveitis patients. Excellent. With a single view you are able to see most of the fundus, but the problem is the vertical view is slightly less, so some of the lesions can be missed. So you can see in this patient there is a small angioma here which is mixed by the OPTOS, and you have to be very careful. You have to separate the lids, tape the lids and get a good image, otherwise you can miss lesions. So you can see here there are angioma in the vertical meridian and a horizontal meridian both, and this can be picked up by both, and but the peripheral lesion is not picked up by the single non-steered view of the OPTOS, but the Spectralis is able to reach the more peripheral areas in a better resolution. So you can see this is a same PSCR patient with steered views. By asking the patient to move peripherally, you can get excellent images in the periphery. So the ICG angiogram, you can see the multiple polyps. In this case of PHCR, you are able to see. You get very good images even with the spectralis. And when you want to go to the periphery, you have to steer. So this is the case of FEVR. You can see the extensive non-perfusion areas in the superior and temporal and inferior fundus. And with the spectralis, you are able to get excellent quality images. You have to just take steered photographs. In a single view, you will not be able to get, but steered view, you can compensate for this and get equally good images as the OPTOS. So you can see this is a case of Coats disease. You can uncover all the angiomas and the non-perfusion areas in the periphery. This is the sectoral laser done for Eels disease, and you can see that with the steered images, you can see whether your laser is sufficient, not sufficient. Occlusive vasculitis, again you can see all the peripheral areas are picked up well with the steered views of the spectralis angiography. We can reach even the aura. So you can say the OPTOS provides you true ultra-wide field. This is some exchange of the headlines. And the Heidelberg remains the gold standard for macular pathology. If you want to study wet AMD or DME, for that, even for the clinical trials, the OPTOS is not approved, but the spectralis is approved because it provides very high resolution images and reliable images of the posterior pole. As far as OCT technology is concerned, I think the OPTOS is still catching up, and maybe in a few years' time they will be quite good. They are still not standardized for glaucoma imaging. They don't have OCTA. So simultaneous angio and OCT, stereo ICG angiography, glaucoma module, all these things are not available with the OPTOS as of now. But I think it's just a matter of time. It's a work in progress, and they will have good imaging. So the main advantage of the spectralis is excellent infrared imaging, which allows you to track what is happening inside the eye. So with this true tracking, you are able to know where exactly the scan is going. You can alternate the scan. This is the only machine which will tell you what is actually the machine is doing. You can see the scan pattern. You can see from top to bottom how the scan is taking place. So this is very important point-to-point registration and to know what exact image you are taking. You can get excellent images as well as the OCT angiography. Very good glaucoma imaging, very good anterior segment imaging, which is not yet possible with the OPTOS. So the advantage of OPTOS is basically doing the OCT of the periphery. So whether it is applicable for you in your practice, you have to decide. So because mostly for research and publications, you will be needing this a very wide field kind of OCT images of the periphery. So it's up to the clinician to decide. Other things are that there is slight delay in the capture of imaging. So the early angiographic events are captured much better with the spectralis, and where the patient has got poor fixation, media opacities, or in poor dilatation, because you have a joystick in hand, you are able to get hold of these situations in a much better way. Overall, for angiography and everything else and the color fundus photography, OPTOS remains having an edge because it is going very wide in the periphery and getting in a single shot. But with the spectralis, if you use your machine wisely, you can get all the same information as there with the OPTOS. So in conclusion, both machines are excellent. You have to learn to do what you have, and both machines are excellent. This machine has got this advantage and this machine has got this advantage. Some drawbacks and advantages are there. So you have to decide which you want to go for. Both machines are excellent. Thank you.